Next up, we have Dr. Robert Stone. He is a pediatric neurologist with special expertise in caring for children with immune conditions affecting the neurologic system and those with inherited disorders of white matter, such as leukodystrophies, as well as acquired immune conditions. He currently serves as director of the Pediatric Neuroimmunology and Multiple Sclerosis Program and director of the University of Rochester Leukodystrophy Care Center at the University of Rochester. And today he will be speaking on a newborn screening family guide for Krabbe disease. Thank you, Dr. Stone.
Thanks, Margie. So today, thank you again to Anna and Hunter's Hope for inviting me to talk today. And it's just been some great topics so far that we've been able to hear about. So I'm going to be talking about this new Krabbe Newborn Screening Family Guide that was developed. And this guide exists right now in the Hunter's Hope website as a link, a PDF, and can obviously be printed and in a hard kind of paper form as well as needed. This guide is something that I suspect that over time we're going to continue to update for sure. So kind of each year or two, we'll be updating this as we learn more about Krabbe disease. This was developed by this list here of authors you can see on the right. So our first authors were Camille Kaur, who is a medical student at the University of Rochester, who's already done a lot of great work in the leukodystrophies. Elaine Phillipson, our coordinating nurse practitioner, who recently retired actually from the University of Rochester as well. Of course, Anna Grantham, our wonderful Hunter's Hope and LCN expert. And two excellent, incredibly helpful parents were very integral in putting this together, Carlita Blackwell and Natasha Spencer. Next slide. So here's the kind of the paper that has been alluded to that this group put together about consensus recommendations. And the thing that kind of spurred us to create the family guide was that we did recommend in this paper that families be given written materials by their providers in the first meeting. So we wanted to put together a written material that could be circulated to families, and that's what kind of got us started on this. Next slide. But there's some really important questions that fed into our goals and objectives of putting this family guide together. So the top question there, how do we improve the experience for parents and make this more standard experience for parents? This is a very, very difficult, obviously, experience for parents. And I think not only this talk that I'm giving now, but our next two talks are really going to be centered around this idea of how do we help parents to get through this in a way that makes the most sense and is the most standard and is the most ideal way possible. So this family guide obviously does not solve that problem by any means, but we're hoping to see if we can make some improvements there. How do we support families and help them feel more informed about a very scary and very complex situation? So obviously that is also incredibly important that we do that. And I'd like to have people write into the Q&A or the chat any comments or questions while I'm talking. I'm going to leave a few minutes at the end that we'll be able to have any kind of comments, questions, or discussions about either this family guide and how that might support families. And then the last question there, how do we help providers feel more informed about these recommendations that can be somewhat complicated? And this guide, although it's labeled family guide, we actually had also in mind that there might be primary care doctors or other neurologists or geneticists or other providers who might not be experts in Krabbe disease newborn screen, and that potentially this guide could also serve to help those individuals to feel a little bit more comfortable with the follow-up of these conditions. Next slide. So I'm just going to go through a brief overview of what's in the guide, and I think it would be great if Anna could post perhaps the link so people could pick up the family guide from that link at your convenience and take a look at it. But I'm just going to go through an overview so you can see there on the left our contents, and an important concept throughout this guide is that we do have planned redundancy in here. And what I mean by that is that an educational tool where we repeat certain information multiple times in different sections to help the reader and the families to more fully kind of understand and incorporate that information. The first part, what does the positive newborn screening result for Krabbe disease mean? The second part, how does Krabbe disease affect an individual? And then the third part, what comes next? And I'll go through a little bit more detail about each of those sections. So you can see here for part one that we start with what is newborn screening. A lot of parents might not be totally familiar with what that is. What is Krabbe disease, where some of our planned redundancy comes in with part two. We'll talk a little bit about Krabbe disease. And then why is Krabbe disease on that family state's newborn screen panel? Next slide. We then go into a little bit about how Krabbe disease is inherited, kind of giving some explanations of that recessive inheritance pattern. Next slide. And then very, very important, as multiple people have talked about so far today, we go into a little bit about the fact that there's different types of Krabbe disease. And that's really important to understand, especially in certain states that, unlike Kentucky, that are using more than just the Sancozine as their second-tier test. So you can see here that we've sort of separated it into unaffected, meaning babies that are not at risk for developing Krabbe disease, versus infantile Krabbe disease, including the concept of early infantile, meaning that the goal would be ideally to get transplant by 30 days of life, and later onset Krabbe disease, separating out those at higher risk versus lower risk of later onset Krabbe disease. And most specifically what that means is higher versus lower risk of developing later onset Krabbe disease in early childhood. And that, as Dr. Kurtzberg just mentioned, helps us to consider how aggressive or frequent testing needs to be at those early ages. Next slide. And then the last part of part one is just some ideas about what to expect at the first appointment. And this guide may actually be given at the first appointment, but I think that this is a useful, I'm hoping, and our group of authors are hoping that this is a useful amount of information that parents can also kind of think about what they experienced at their first appointment. And does that line up with what we're thinking they might expect at their first appointment? And that might be an important thing for parents to be considering. Next slide. So the second part just talks about Krabbe disease as a condition, how it affects the individual, separating it out into infantile Krabbe and later onset Krabbe disease. For infantile Krabbe, giving some ideas about the symptoms, the importance of expedited testing and the potential treatments. And for later onset Krabbe disease, talking about those symptoms in the later onset, as well as the idea that as the onset gets later and later, the rapidity or how quickly the disease progresses slows down. Next slide. Lastly, we talk about what comes next. So what we do here is we separate this out into the three different kind of possible outcomes of that testing and what might come next for those individuals. So we'll have a group of individuals that might be carriers or have pseudodeficiency alleles who ultimately are not going to be at risk for Krabbe, so what they might expect. Individuals who are at risk for high risk for infantile or early infantile Krabbe disease. And here, obviously, we mention the treatment possibilities with some question ideas to ask the doctor, again, highly informed by our parent authors who are quite useful. And then finally, later onset Krabbe disease, and what follow-up might look like based on the recommendations that we had published in that recommendations paper, as well as question ideas that parents might want to consider to ask their doctor. There's just some examples of some of the questions that are in that section. Next slide. Oh, go back one, I'm sorry. I just wanted to mention that at the end of the guide, you could see there on the green box on the left, that we do go through just a little bit of information about other siblings, give some support, links and resources, and then some information about clinical trials as well. Just a small amount of information in those areas. Okay, next slide. So that's actually the bulk of what I wanted to go through. And I wanted to leave some time if people have comments or questions about this for discussion. And I think two things that we're really thinking about now that we've come out with our first iteration of the Family Guide. Number one is this was really tough. How do we balance the need to give families a lot of this important information and also try not to overwhelm those parents who I'm sure no matter what we do in the Family Guide are going to be feeling very overwhelmed, of course. So we feel that maybe, you know, if people are taking a look at it, there's a lot of information in there. Maybe we went a little overboard on the information. Maybe we should be paring this back to be more simplified. On the other hand, there certainly are different individuals that, different parent or guardian individuals who are going to be really interested in more information versus, you know, not quite as much, etc. So part of what we hoped for was that parents would kind of focus in on the sections that they were most interested in learning about. So that's one thing that we're considering. And then the second point, which is really important, is how do we get this guide out to the people who need it? We obviously have it. It's sort of our first iteration is complete. It's on the Hunter's Hope website in this PDF format. And you know, how do we get this out to providers who are following up newborn screen results, and they might not be experts in this, you know, complex algorithm. And, you know, perhaps this can help inform them a bit on, you know, how to get more information. And then, of course, to families who have gotten a recent newborn screen result. And that's something that we've been discussing at the newborn screen, the Krabbe Newborn Screen Council. Idea of getting this guide out to the state labs or other ways that we can try to get this to families. So I'll stop there. And